Hey, hello everyone. My name is Ruksaranchum. Welcome to my YouTube channel जिसका नाम है Knowledge Hub. Hope you all are doing fine. So आज का हमारा टॉपिक है leprosy. In this we'll study about epidemiology, etiology, the clinical features, diagnosis, and even the management. So, what is epidemiology first of all? Epidemiology is nothing but it is the study of the distribution and even the determinants of health related states and the events in a specified population. So this is what we call it as epidemiology. First of all, what is leprosy? Leprosy क्या है? In Kannada we call it as कुष्ठ रोग. हिंदी में हम उसे बुलाते हैं कुष्ठ रोग. So leprosy is a leading cause of permanent physical disability amongst the communicable diseases. Leprosy is a chronic infectious disease which is caused by the bacteria Mycobacterium leprae. As you can see, the microscopic observation here in this picture. So this is the microscopic observation of the bacteria which is called as Mycobacterium leprae. Now, let us know the history. So, history which means origin कहाँ से हुआ था? The earliest record of leprosy-like disease came from Egypt, dating as far back as 1400 BC. In China and India, the first records appeared in the 6th century BC. So in China, a disciple of Confucius, who was named as Pliny, suffered from a disease resembling lepromatous leprosy, which was known at the time as Li, or else we call it as Lai. In India, leprosy was first described in the Sushruta Samhita and treated with chaul mogra oil was known at the time. So what is chaul mogra oil? So it is nothing but a common ingredient in the product which is meant for the sensitive and irritated skin as it moisturizes the skin and it supports its immunity against the bacterial infection. So this is the reason why we use chaul mogra oil. It is said that leprosy was referred to as kusht in Hindi, which means in the Vedic writing, which is nothing but in Hindi we call it as kusht, which is how the disease is known as even to this day in India, in Nepal, Indonesia, Malaysia, and many other countries in the Southeast Asia. So the clay statues of leprosy patients were also found in Mesopotamia. Mesopotamia, it is nothing but a region in Iraq. So earlier it was known as Mesopotamia, now it is called as Iraq, dating as far as back as 400 BC. Initially, leprosy patients were isolated and segregated. Communities were hostile to them, and the patients were also self-conscious and afraid to mix with the community. Why they were afraid to mix with the community in the sense is like it was a communicable disease, which means एक से दूसरे को फैलने वाला. So people were kind of afraid at that time. डर था उन्हें. So they were afraid to mix with that community. Leprosoria to segregate the patients from the community were built in Europe in the Middle Ages. Several statutory acts and laws were also enacted during that time against them. So it was in the year 1873 where Dr. Gerhard Henrik Armauer Hansen of Norway was the first person to identify the germ that causes leprosy under a microscope. So in that slide we have shown the microscopic observation. That is how he observed under the microscope. This is a scientist, Dr. Gerhard Henrik Armauer Hansen, who was from Norway. Hansen's discovery of Mycobacterium leprae proved that leprosy was caused by a germ and was thus not hereditary from a curse or from a sin. A drug, chaul mogra, which is nothing but What was it? The cholmogra? Cholmogra is an ingredient. It was a product which was used for the sensitive and irritated skin. Why was it used? Because it moisturized the skin. It even supports its immunity against bacterial infection. So this is the reason why cholmogra oil was used for the leprosy treatment until dapsone was discovered with anti-leprosy effect during 1940s. It was in the 1970s when multi-drug therapy, we call it as MDT, consisting of rifampicillin, clofazimine, and dapsone, were identified as cures for leprosy, which came into a wide use from the year 1982 following the recommendation of World Health Organization. Since then, the service of leprosy patients gradually changed from institutional to outpatient care through health centers and field clinics. Gradually, the infected and cursed leprosy patients began to be accepted with the community as a result of intensive health education and visible successful results of MDT. So, what is MDT? It's a multi-drug therapy. Next, let's see what was the case of leprosy. So, a person having one or more of the following features and who has yet to complete a full course of treatment. It was hypopigmented, or as we call it as reddish skin lesions with definite loss of sensations. Involvement of peripheral nerve. The involvement of peripheral nerve is nothing but demonstrated by definite thickening with the loss of sensations. Then skin smear positive for the acid fast bacilli. ओके तो गाइज आज के लिए बस इतना ही. अगर आज का वीडियो आपको पसंद आए तो प्लीज़ लाइक, शेयर, कमेंट करें और सब्सक्राइब करना ना भूलें फॉर द मोर वीडियोज़ लाइक दिस. थैंक यू.